Maintaining the joint line is one of the most important things in knee replacement. We want to put that joint, the place where it bends, right back where it should be. The challenge is that the patient often has a lot of deformity from the actual arthritis. Their knee is now bow-legged or knock-kneed, and it's very hard to determine where that is. With off-the-shelf implants, we use a number of jigs and alignment guides to try to estimate where that joint line should be. But even in that case, we're still approximating what that surface should look like. The bearing surfaces are often fairly flat and fairly straight across the knee, which is not the case in normal anatomy. The lateral side is higher than the medial side. The curves are different on either side. The bearing surfaces are different widths and different heights. And we can't replicate that with an off-the-shelf implant. As a matter of fact, we try not to because it would make design extremely hard. With the Conformis knee, the computer can calculate out exactly where those bearing surfaces should be, the correct radius of curvature, and the correct difference between the medial and lateral side. One of the really interesting things that we see when we get the actual implant is that there's a step-off between that medial and lateral side, which mirrors the patient's real anatomy. And in some patients, it's actually straight across, and in other patients, it's as much as 4 or 5 millimeters difference. And it's different on every patient.